Stop for a moment. If you're over 60 and still doing crunches to flatten your belly, you need to hear this. Last year alone, more than 700,000 people over 65 fractured their spine. Two-thirds of them never even knew it happened. Every single crunch creates about 450 pounds of pressure on spinal discs that have already lost up to 40% of their cushioning. That's like crushing dried sponges and calling it exercise. Even the Navy SEALs banned sit-ups in 2020. Too dangerous for elite 25-year-old soldiers. So what do you think they're doing to a 65-year-old spine? Here's the truth. An ordinary towel can flatten your belly more effectively than 1,000 crunches. A 2019 study proved it. Adults over 60 using this Japanese towel method lost an average of 3.8 inches. Traditional exercises, just 1.2 inches, and 67% develop new back pain. When you wake up in the morning, your spine is actually taller, about 10 millimeters taller. Your discs rehydrate overnight. But those swollen discs are also more vulnerable to injury. That's why 43% of back injuries in adults over 60 happen within the first 2 hours of waking. From simple things, bending over, tying shoes, or doing morning crunches. Each crunch delivers another 450 pounds of pressure. After 60, your discs can only tolerate about 5 to 8,000 flexion cycles before permanent damage begins. 50 crunches a day? That means in about 5 months you've exceeded your spine's lifetime tolerance. Every year, 35,000 adults over 60 end up in emergency rooms from exercise injuries. 8,000 of those are from crunches alone. That's more than 20 people every day getting hospitalized while trying to get healthy. And here's the part no one tells you. Belly fat after 60 is not a muscle problem. It's 3 problems that crunches actually make worse. First, your transverse abdominis becomes weaker. Crunches train the wrong muscle. Second, your posture shifts forward. Crunches exaggerate it. And third, visceral fat responds to hormones. Crunches raise cortisol, which tells your body to store more fat, not less. 1 in 4 women over 65 already has a fractured vertebra and doesn't know it. Each fracture increases the risk of death by 23% within 5 years. Not from the fracture itself, from pain, immobility, and loss of independence. Once you've had one compression fracture, your risk of another increases by 500%. Doctors call it the fracture cascade. One injury triggers the next, like falling dominoes. Studies show seniors doing traditional core exercises 3 times per week have higher fracture rates than those who only stretch. 89% of them were doing flexion-based movements that compress already weakened discs. And here's how fragile spines can become. Every year, 15,000 people over 65 fracture vertebrae just from sneezing. But there is good news. Seniors using non-flexion core work reduce fracture risk by 47% and improve bone density by over 3% in 6 months. Your spine can heal. Dr. Toshiki Fukutsudzi spent over a decade studying more than 6,000 patients. What he discovered was simple and powerful. By placing a rolled towel under very specific points of the body and holding precise positions, the skeleton resets itself. The pelvis tilts naturally. The rib cage opens. The spine lengthens. Deep core muscles engage automatically. No compression, no force. You use gravity instead of fighting your body. In a clinical follow-up study, adults aged 60 to 75 were tracked for 10 weeks. The towel group lost 3.8 inches with 0 back pain. The traditional exercise group, 1.2 inches, and 67% reported increased pain. Here's how to prepare. Take a bath towel, about 27 by 54 inches. Fold it lengthwise. Then roll it tightly. Imagine wringing water out. Secure it with rubber bands. You want about a 4 to 5 inch diameter. Firm when pressed. Use a yoga mat or carpet, not a bed. Too soft, not hardwood. Too hard. If you have severe osteoporosis, recent surgery, or are pregnant, consult your doctor first. Let's start with position 1. It resets pelvic tilt and activates the transverse abdominis. Sit on the floor, place the towel behind you, slowly lie back, so the towel sits behind your belly button. At spine level, your body will form a gentle arch. Now extend both legs straight, feet hip-width apart. Go slow. Let the big toes touch and allow the heels to fall outward. This internal rotation activates the lower abdominal wall. Reach your arms overhead, palms down, pinkies touching. Now breathe. Inhale through the nose for 4 counts. 1, 2, 3, 4. Feel your belly rise gently against the towel. Hold for 2. 1, 2. Now, exhale through the mouth for 6. 1, 2, 3, 4, 5, 6. As you exhale, feel the belly draw inward, like a soft vacuum. This activates the transverse abdominis, your internal corset. This is what flattens the belly and not crunches. Hold for 2 minutes. If that feels intense, start with 30 seconds and build gradually. To exit, bend your knees, slowly roll onto your right side. Pause for 3 breaths. 1, 2, 3, then push up slowly. Position 2 opens the rib cage and targets the upper belly. Move the towel to the middle of your back, just below the shoulder blades. Lie back. Legs stay the same. Reach your arms overhead again, but this time turn the palms up. Pinkies touching. Feel your chest open. This reverses years of forward hunching. Every inch of forward posture adds about 10 pounds of pressure to the spine. As the rib cage opens, the diaphragm drops fully. Your lungs expand up to 40% more, which means more oxygen, and more oxygen means better metabolism and better fat signaling. Continue with same breathing pattern. Inhale 4, 1, 2, 3, 4, hold 2, 1, 2, exhale 6, 1, 2, 3, 4, 5, 6. As you exhale, feel the ribs draw inward. Hold 1, 2, 3, 4, 5, 6. Roll to your side and sit up slowly. Many people feel slightly taller. Position 3 releases tight hip flexors that pull the pelvis forward and push the belly outward. Place the towel horizontally under your sacrum, the triangular bone above the tailbone. Lie on your back, bend both knees, feet flat, hip width apart, arms at your sides, palms down. Extend your right leg straight, lift it just 2 inches. The left foot stays planted. This asymmetrical position allows the right hip flexor to release. Press your lower back gently into the towel. Breathe. Inhale 4, 1, 2, 3, 4. Hold 2, 1, 2. Exhale 6, 1, 2, 3, 4, 5, 6. As you exhale, draw the lower belly inward. Hold 1, 2, 3, 4, 5, 6. Now switch sides. Left leg extends, right foot stays planted. Another minute. Then hug your knees in, rock gently, and roll up. Position 4 targets the most stubborn lower belly area. This is Fukutsuji's lesser-known technique. You'll need 2 towels, one under the sacrum, one under the knee creases. Lie back. Allow your knees to fall open, like frog legs. Bring the soles of your feet together. Place both hands on your lower belly, fingers pointing down. This tilts the pelvis backward, opposite of decades of habitual positioning. It activates the deepest abdominal fibers and the pelvic floor. As these muscles wake up, they gently pull the lower belly inward and upward. Now breathe differently. Inhale for 4, exhale for 6. As you exhale, press your hands gently into your belly, teaching the muscles what to do. Hold for a few minutes. If your inner thighs shake, that's perfect. If emotions surface, that's normal. Keep breathing. Bring the knees together. Remove the towels. Lie flat for 30 seconds. Notice your lower back, then roll to your side and sit up slowly. Here's the full protocol. Position 1, 2 minutes. Position 2, 2 minutes. Position 3, 2 minutes total. Position 4, 3 minutes. 9 minutes total. Morning on an empty stomach or at night before bed. Results follow a pattern. Week 1, posture improves. You stand taller. Your belly looks flatter. Weeks 2 through 4, core strength builds. Breathing improves. Clothes fit differently. Less bloating. Weeks 5 through 10, visible fat loss may occur. Waist size reduces. Core stability returns. Some people lose 3 to 5 inches. This isn't a quick fix. It's a permanent one. If you've tried everything and nothing worked, this is why. This isn't about willpower or punishment. It's about working with your 60-year-old body, not against it. Undoing decades of structural stress. You don't need to end up in an emergency room. You need 9 minutes, a towel, and the willingness to lie down and breathe. Your spine can heal. Your core can strengthen. Your belly can flatten. Starting today.